The Translational Pulmonary and Immunology Research Center has been deploying coronavirus testing for the last few months, and I'd like to take a few minutes to describe to you what those different tests are and how they can be helpful to you. So we deploy two different types of testing methods in our laboratory. So I'd like to first talk about the more common one. It is called PCR testing, and this is the test that has been most widely used really since the beginning of this actual virus, all the way back in January. There are two primary ways to actually conduct PCR testing. One is through what's considered the World Health Organization type standards, and one is through the CDC-based standards. The type of testing that we offer for PCR basis is actually equivalent to both. It is a high-level, high-complexity form of PCR testing that gives you a very accurate diagnosis. This testing has to be done with a swab that's conducted in the back of the throat, and it acquires samples that are either from the top of your lungs or from the back of your nose and sinuses, and that's how we get an accurate reading on that test. If you capture coronavirus, you're going to be positive in the first number of hours with the PCR test. Most people will produce a positive PCR result from day 0 or the start of symptoms up to approximately days 7 to 9. But if you continue to produce coronavirus during illness, even if you have minimal to no symptoms, you may continue to produce a positive PCR result up to 30 days out. One thing that the PCR test allows us to do is to know that if there's active residual virus particles that are being expressed in your system, then you are actually at risk of spreading this silently. So that's the concept of shedding this virus. The best case scenario is that if someone has actually had coronavirus, that they actually have a negative PCR test at the end of their illness time period, which means that you know they can no longer spread the virus. The second form of testing that we offer is called antibody testing. And antibody testing is something that has been discussed widely over the last few months. Unfortunately, we do not have a single best antibody test that is available. There are dozens and dozens that are used worldwide. The test that we are currently using is one of the top 3 that the FDA has localized as kind of the best performers, and it is very close to 100%. It's somewhere in the 99% range for specificity and 96 to 99% range for sensitivity. These are statistical terms that reflect the accuracy of the actual test. Antibody testing is broken down into 2 primary antibodies. One is called IgM. IgM antibody is what is first produced during the initial phase of infection. So typically within the first few days, ideally around day 5 to 7 of the actual coronavirus infection, and it may last all the way up to 21 days out. Individuals who do not convert their antibody response well enough may have an IgM antibody level that stays high for up to 6 or 8 weeks post-infection. The second antibody is called IgG, or Immunoglobulin G. This antibody is very critical. It actually tells us that a full switch towards what's called a neutralizing antibody has been actually achieved. And that's a very important thing to note for those who've actually had the virus and have had a full state of recovery. I think one of the most important aspects of studying these 2 different antibodies over time is, again, we're trying to study a 30-day window. We would like to know if someone is at the end of a 30-day cycle that they are PCR negative, and if they've had coronavirus, we'd ideally like to see IgM and IgG positive at the end of that 30-day window to know that their immune system has the most robust response possible. So within a 30-day time period, with both PCR testing and antibody testing, we can, with a large degree of certainty, confirm that you've been exposed to coronavirus, which is COVID-19 virus, and not any one of those other common beta coronaviruses that cause common colds, which is exactly why we run this comprehensive form of testing.